Okay, next. Young lady back there. Yeah, right there. Go ahead. And we got a microphone coming. Oops, wait. It's this young lady's turn first. Okay, but I'm sorry, I called on her, and we'll make sure to get back to you. Go ahead, right there. Yeah, you're standing up. Yeah. No, right back there. That's really young, there. Right there. You know, you can just hand her the mic. I know it's hard to get through these items.
Hi, thank you. I work with drug-addicted adolescents and adolescents with mental health problems. And I'm very tired of having to beg insurance companies to give them the treatment that they deserve. I feel like insurance companies have way too much control and power in the system that we have now. And I'm wondering what your thoughts are on that.
I agree with you. And you know, insurance companies are some of the biggest players in Washington. And that's why it's so important not to have them finance your campaigns. Because when they do, they got their hooks in. And it becomes very hard then to make good decisions in terms of where should our healthcare system be going. That doesn't mean that insurance companies don't have a role to play. They do. But they've come to dominate the system so much that our healthcare system is just broken. It's just not working for ordinary people in all sorts of ways. So let me talk generally about healthcare, and then I'll talk specifically about issues of substance abuse and mental health and some of the concerns that you raised. I have proposed, as I said, a plan where if you've got health insurance, your biggest problem is rising costs. And so what we're going to do is we're going to set up what's called a catastrophic reinsurance program that works with employers to cap the spike in premiums that happens when, let's say, a single person in a company gets leukemia and it's $1 million and suddenly everybody's premiums go sky high. If we can cap the rise in those premiums, those savings can be passed on to employees. All right, that's step number one. Step number two is, as I said, to set up a government plan similar to the one I was a member of Congress. Because there will be a big pool of millions of people, you can then negotiate for good terms. And we will subsidize anybody who can't afford it. So there will not be anybody in America who wants health care who will not be able to get it under my plan. All right? You won't be able to be excluded for pre-existing conditions, which is what a lot of insurance companies do. And I have personal experience in this. My mother, when she got sick with ovarian cancer, she had just gotten a new job, and the insurance company was saying, well, maybe this is a pre-existing condition, so maybe we don't have to pay your medical bills. So I know what it's like to see a loved one suffer, not just because they're sick, but because of a broken healthcare system. This is personal for me. We're going to emphasize prevention because really that's what our healthcare system has to do more of. It doesn't make sense. Right now, if you go to a doctor and you say, I want to go to a dietitian to help me lose weight, the insurance company may not cover it. But they'll cover a $30,000 foot amputation because you've got diabetes. Yeah. That doesn't make any sense. So the more prevention we emphasize, actually over the long term, the more savings we will get in the healthcare system. And we estimate we can save $100 to $150 billion with a B every single year. And that's what we'll use to help subsidize those who don't have care. All right, so that's the plan that I'm putting forward. Now, well, I will be happy to answer that. You kind of cut in line. The reason that I have not proposed what's called a single payer plan, which would be just a single government run plan, I actually would probably institute a single payer plan if I was starting from scratch. But I'm not starting from scratch. I've got a legacy system of half the people, more than half of the American people get their health insurance through employers. And you have insurance companies and HMOs and a whole legacy of systems that aren't going to go away overnight. So what I want to do is make the system more efficient first, get everybody covered. Over time, people will be able to opt into the government plan that I talked about. And so it may transition over time. All right? Now, just to get to your specific point then, when we talk about substance abuse, when we talk about mental health services, and I'm strongly in favor, for example, of mental health parity, requiring insurance companies to treat mental health services like other products. To me, that falls in the category of prevention. And it's not just prevention for the individual patient, it's actually good for the society as a whole. You talk to police officers in most urban areas, and they will tell you a huge amount of their time is devoted to responding to calls because people are homeless and at risk to themselves. And they don't have the capacity, they don't have the treatment facilities, and so people, our police officers who should be fighting crime, they're instead of, basically engaging in social services that could have been prevented if we had provided people good mental health services or substance abuse services in the first place. Back to this point. People ask me, why you instead of Senator Clinton, or why you instead of, they don't ask me why me and Senator Kane, because that's easy. But I think the big difference, Senator Clinton has a very good health care plan. It's very similar to mine. But the problem is, she doesn't, I think, understand, or at least isn't willing to fight against the way the system now is working in Washington that will prevent any good plans from getting forward. Now, I admire the fact that the Clintons in '93, they put forward a way to try to reform the healthcare system. I give them credit for that. But they did it in the wrong way. Because what they did was they just went behind closed doors. They were very secretive about it. They wouldn't even invite members of Congress in, but more importantly, they didn't invite the American people into the debate. So what happened was, by the time they put their plan forward, the insurance companies, the drug companies, the HMOs, they had organized Congress. They had given all their campaign contributions to the committee members. They had run ads on TV so that the American people were confused about what the plan looked like. By the time the Clintons released the plan, it was dead on arrival. Now, I'm going to do it differently because I believe we've got to change how the process works, how politics is done to overcome the corruption of the campaign finance system. So here's what I'm going to do. Within the first couple of months of me being elected, we're going to call together a big meeting. We're going to have a big round table, and I'm going to invite everybody. We'll have doctors, nurses, hospital administrators, employers, labor, patients advocates. Everybody will be sitting around the table. Insurance and drug companies will give them a seat at the table. They just won't be able to buy every chair. And I'll sit at the table. I'll have the biggest chair because and I'll put my plan forward for reform. And I'll welcome anybody's ideas to improve it. Because I don't assume I know all the answers. So if other people have good ideas, Republicans, Democrats, I want to listen to them. But here's the difference. I'm going to do it all on C-SPAN. So, the American people will know what's going on. And so if you've got some member of Congress who's carrying water for the drug companies, saying, well, we can't negotiate for the cheapest available price on drugs because all these drug companies need all these profits in order to invest in research and development. Well, I'll be able to call in my healthcare expert in front of national television and ask him, is that true? And what he'll say is, well, the drug companies do need some profits to reinvest in research and development, but most of the research and development is done by taxpayer money. It's just that drug companies get the profit on it.